Hey, A&P students, welcome to our second lab on muscles. Today we are going to actually name some muscles. This is really good. Last time we did just introduction, we did some histology, looked at a single skeletal muscle fiber. Today we're naming some muscles and we're doing the head, the neck, and the torso. Good news is we're not doing all the muscles in the head, neck, or torsos. So let's get started. So I got a head model right here with a lot of beautiful muscles on it. And I want to start with a muscle called the epicranius. The epicranius. Check out that word right there, epicranius. Epi on top of, cranius, the head. So the epicranius is on top of the head. Another name for it is the occipitofrontalis. And this is a perfect name because this muscle has two parts. Has one part right here, that's called the frontal belly of the epicranius. Another part right here, which is called the occipital belly of the epicranius. In between them, so like connecting right here to right here would be this flat tendon. And a flat tendon, by the way, is called an aponeurosis. And what happens is when this frontalis, this frontal belly, contracts here, this guy contracts to make sure this end stays put, and what it does is it brings your eyebrows up and wrinkles your forehead. So it's going to bring up your eyebrows. Imagine your eyebrows coming up and surprise, your forehead wrinkling. That is what the epicranius does. Now, sometimes people can have what's almost like two frontal bellies, like two separate halves of this muscle. If you've ever seen somebody who can bring that like right eyebrow up and then make that left eyebrow up and make them dance like that, then that's what they're doing. All right, one muscle down, only like 60 to go. Okay, another muscle we see here, let's get rid of all this stuff. Another muscle we got here is this muscle called the temporalis. All right, you can see it originating up here on the parietal bone. Good old parietal bone. Remember, the origin of a muscle is the less movable attachment point, okay? So it's originating up in the parietal bone. It's coming down and inserting. We can't see the insertion point because of all the other muscles and stuff hiding it. But what it's inserting on is the coronoid process of the mandible. Remember, the insertion of a muscle is the movable attachment point. And so when this temporalis muscle contracts, it elevates your mandible. If you put your couple fingers on your temple region of your body, of your head, and you clench your jaw, like I'm doing now, you will feel the bulge of your temporalis. Okay, another muscle for jaw clenching is this muscle called the masseter. Masseter the word has to do with chewing, kind of like the word mastication. We see the masseter right here. It is going to originate on this zygomatic arch that we have here. And it's going to come down and grab onto the angle, the ramus of the mandible. And it's going to pull your mandible up. If you put your hand kind of like on the very back of your cheek and you clench your jaw again, you should be able to feel the masseter kind of bulging out. So notice that the masseter and the temporalis, they are doing the same job. They are both elevating the mandible. So these guys are called synergists. Erg means work. Syn means together. So a synergist is something that is working together. So two muscles that are working together to achieve a common action are known as synergists. Okay, good. Got a couple muscles to get started there. Let's keep going. So, check it out. Got two dudes here. We can see a masseter bulging right there. Very nice. We can see some epicranial action raising this eyebrow on this gentleman down here. All right. Back to my beautiful head model. Couple more muscles here. Starting with this diagonal-ish one. This one right here is called the zygomaticus major. Zygomaticus because he's originating on the zygomatic bone, and then he's inserting onto connective tissue at the corner of the mouth right here. Okay, so origin's up here, insertion is down here. And what this is going to do, when this muscle contracts, it is going to draw the corner of the mouth up and out like you are smiling. Like you're smiling. Smile. Say it like that. Smile. If you're smiling, you're using your zygomaticus major. There's another smaller muscle called the zygomaticus minor that we're not concerned about. In case you were wondering, well, why is this using the word major? It's not that big. It's because there's another one that's smaller. Okie dokie. Moving right along. We got this muscle right here, forming a beautiful circle around the eyeball, more or less. It's called the orbicularis oculi, circling the eyeball, circular of the eye. It's going to close your eye. Think about scrunching your eyes shut. Think about winking, using just, of course, one eye. Those are actions of the orbicularis oculi. Now, this is not the only orbicularis muscle. There is also an orbicularis oris going around the mouth. It's going to help close the mouth. Not really like jaw smashing close, but just think about, like, let's say your mouth is open in surprise. Then you close it without really moving your mandible forcefully or anything. That's your orbicularis oris in action. Let's say you are whistling. It's like the best whistling I can do right there. If you are whistling, think about the shape of your lips when you're whistling. Or if you're making a kissy sort of face, puckering or pursing your lips. Those are all actions of the orbicularis oris. So, by the way, you can do all these actions, all the time, and you can say the name of the muscle when you do them. So you can practice this, you can study this all the time. Make a winking motion. Wink at somebody you know, preferably, and say orbicularis oculi. Make a whistle sound and say orbicularis oris. Smile at someone you like, or someone you don't like. Smile at everyone and say zygomaticus major. So use these muscles, say these words. Okay. So got some beautiful kids here demonstrate the actions of these muscles. So we got a little bit of, lip action here. Orbicularis oris. Smiling so nicely. Zygomaticus major. Scrunching those eyes shut. Orbicularis oculi. Okay. If we look at another model, this is just a different model with a different face. We can again see the epicranius, the frontal belly, the frontalis part. And you can see how it's kind of like got two parts to it here. We can see the orbicularis oculi around each eye. We can see a zygomaticus major with that angle towards the zygomatic bone right there and right there. We can see the orbicularis oris encircling that mouth. Now another muscle we can see here is a neck muscle. This is a big, strong neck muscle. We see it right here. It is called the sternocleidomastoid. Sternocleidomastoid. Sterno, because it originates on the manubrium of the sternum. Cleido, because it originates on the clavicle. Mastoid, because it inserts on the mastoid process, which is just behind your earlobe. Stick a finger behind your earlobe, you'll find that bumpy protrusion. that we learned a while ago. That is the mastoid process of the temporal bone. When you're using your sternocleidomastoids bilaterally, so you're using the one on the left and the one on the right. When you're using them bilaterally, so using them both of them, that is going to bend and flex your neck. Imagine you were lying down on your back and you do a sit-up with your neck, okay? You're going to use your sternocleidomastoids to do that. Try this out. You'll feel both sternocleidomastoids bulging. Now, when you use one of these guys unilaterally, so just one side contracts, you are going to notice a different movement. So unilateral contraction is going to cause, so when just one sternocleidomastoid contracts, it can do two things, okay? It can cause ipsilateral flexion. So I'm going to use my right sternocleidomastoid to try to touch my right ear to my right shoulder by bending my head down. That's ipsilateral flexion. I can also use my right sternocleidomastoid to turn my head to my left. So that is contralateral flexion. So remember, the sternocleido comes up and goes behind the ear. Imagine you reached out and you grabbed this guy's ear and pulled it towards you. His head would turn this way. So the sternocleidomastoid does contralateral rotation. Look at all those O's in sternocleidomastoid. All those O's stand for opposite side because it's an opposite side rotator. It does contralateral rotation. Okay, cool. Let's keep going. We turn this guy to the side so we can see the frontal belly of the epicranius again. We can see the orbicularis oculi, orbicularis oris, the masseter, and now we can also see the sternocleidomastoid again. And we can see another neck muscle here on the back, right there, that little guy right there. Okay, notice how his fibers are kind of going towards the not kind of going, they are going to the mastoid process, just like the sternocleidos did, but they're coming from the back. We'll do this big muscle here next time, don't worry, okay? But this guy with number 6 on it, this guy right here, that is called the splenius capitis. Literally means the bandage of the head, which is not very helpful to me. So, the splenius capitis is kind of like the sternocleidomastoid. When both muscles are contracting, so when it's bilateral, so both right and left contracting, it is going to extend your neck. So if you drop your chin towards your chest, then you pull your head back up. That action of pulling your head back up, straightening your neck, is your splenius capitis at work. If you find it's kind of like a hollow spot on your neck. So if you go up in your neck and you find the back of your neck and you find your vertebral column and you go to both sides of it, there's kind of a dented area between some muscles, and you can feel your splenius capitis your splenia capitis. You can feel them right there when you extend your neck. So, let's notice something here. The two sternocleidos flex the neck. The two spleniae capitis extend the neck. And by the way, quick review. Flexion is a decrease in joint angle. Extension is an increase in joint angle. We covered that a while ago. But, again, back to it. Sternocleidos, so two sternocleidos are going to flex that neck. Two spleniae capitis are going to extend that neck. So these guys are acting as antagonists in this situation. They are doing the opposite job. All right. Now, let's talk about the splenius capitis when it's acting unilaterally, when just one side is contracting. In that case, it causes ipsilateral rotation. So it turns to the same side. Splenius capitis has more S's because it turns you to the same side. So imagine grabbing this ear and pulling kind of backwards on it. The face would come forward, like out of the computer towards you. I can't draw that perspective. Yeah. Okay. Awesome. So let's look at a person whose head is turned. Let's do that. All right, we got this nice lady here. Her head is turned to the left. So because it's turned to the left, we're going to use two muscles here, all right? Two muscles to turn to the left. We're going to use the sternocleidomastoid. That's our opposite side rotator, our contralateral rotator. So it's her right sternocleido that we see bulging because she's turning to the left. So we're going to use her right sternocleidomastoid. At the same time, we're going to use her left splenius capitis. Splenius cap. Boom. All right. Good stuff, good stuff. I think we're done with the neck. We're almost done with the head. It's one thing we didn't do in the... Oh, we're not done with the neck yet. I forgot about one. I spoke too soon. There's another muscle in the neck that's not visible in any of the typical muscle models that we use because it is a really superficial muscle. Still important though. It goes from basically the chin and the jaw down into the chest and the shoulder. It's called the platysma. Platysma, platy means flat, so it's a pretty thin and flat muscle. It is going to depress the mandible. So because it depresses the mandible, it is acting as an antagonist, doing the opposite job. The antagonist to two muscles we saw earlier, the temporalis and the masseter. Which I'll just abbreviate there. It's not the only thing this muscle does. The platysma also tightens the skin in your neck. You can see this guy is using his platysma. If you try and show all your teeth grimace like that, you can make your neck kind of pop out. You can see the edges of the platysma kind of pop out in your neck. All right. So we got that platysma. Superficial muscle, so we didn't see it earlier. Now, let's do one more thing in the head. Now we're done the neck. We got one more thing in the head to do. That thing in the head to do is we're going to do 4 extraocular muscles. I know you know that there are 6 because we did all 6 when we were talking about the cranial nerves. But as far as this lab goes, we're only going to do 4. We got an eyeball here. The pupil would be visible. Whoops. The pupil, not the people, the pupil would be visible on this side. We can see the optic nerve back here. And on the top here, number 1, that is the superior rectus, because it's on top, because it's straight. Superior on top, rectus because it's straight. It is going to elevate your eye. So roll your eyes to look up at the ceiling, wherever you are right now. You're using your superior rectus. Now this guy right in front of us here is the lateral rectus. That's the lateral rectus, which is going to abduct your eyeball. So look to the left, your left eye is abducted, looking out, using your lateral rectus. Now you might wonder, how do I know this is lateral? How do I know this side is lateral? This is the big clue. This is the lacrimal gland. The lacrimal gland is always lateral. Lacrimal gland, of course, makes your tears. The tears of joy you're going to be crying when you do really well in this test. That's what you're going to use, your lacrimal gland. All right, that's 2 muscles we've done there. Let's do a couple more. So now I flipped it over. Superior rectus is still on the top here. Lacrimal gland is on the opposite side now. So this is my medial side of my eyeball. And this guy right here is my medial rectus. This is going to adduct your eye. So think about trying to look at your nose, or take a finger and trying to follow that finger as it gets closer and closer to your face. If you cross your eyes, you're using your 2 medial recti. Okay, cool. Superior view. You can see that superior rectus, that lateral and medial rectus, plus the beautiful lacrimal gland. In this view of the eyeball, where it's actually situated in the eye socket, we don't need to review all the bones here, do we? Probably not. But what we're looking at here is we got the top of the eyeball, the superior rectus. This is the outside right here. The nasal bones are right over here. So this is the outside. So this is the lateral rectus here. Medial rectus is over there. And that guy down on the bottom is the inferior rectus. Of course, the inferior rectus is going to depress the eye, looking downward. Okay, if you look at this lady here, can you tell what muscle she is using to get this eye in position and this one in position? So do that. And now, guys, we're going to do some torso muscles. We're going to talk about abdominal muscles, an internal muscle, and a group of back muscles, and a couple others. We got a bunch to do still. So in this torso that I see here, I've got 2 important muscles. This group right here, 1, 2, 3, 4, this 8-pack right here is the rectus abdominis. The rectus abdominis. When people think about abs and having stomach muscles, abdominal muscles, this is usually the guy that we're thinking about. Everybody has rectus abdominis. Everybody's got abs. Just depends on how much body fat you have. That determines whether or not you can see them. Generally, you got to be in the single digits body fat percentage to be able to see abdominal muscles. Anyhow, the rectus abdominis is going to originate down here on the crest of the pubis, pubic bone, come up and insert on the xiphoid of the sternum, as well as on some costal cartilage under here, under your rib cage. This is going to flex your trunk. Think about doing a classic sit-up. Doing a classic sit-up, you are flexing your trunk. You are using your rectus abdominis. Rectus, of course, because the fibers are straight, vertical, up and down here. A lot of tendinous insertions here. This is connective tissue, this gray stuff that gets a separation between the abdominal muscles. All right, on the side lateral to the rectus abdominis, I have a muscle on each side called the external oblique. The fibers are at an angle. That's why the word oblique is being used here. Think about if you were wearing a hoodie and you stuck your hands in your hoodie pocket. You would be kind of at the external obliques. When the external obliques are acting bilaterally, they are going to flex the trunk. When they are acting unilaterally, they are contralateral rotators. Okay, this is good. We're done some abdominal muscles. And by the way, notice that there is an external oblique. Can you guess there also is going to be? Yeah, we shall see. All right, switch models. This big torso model here. Got my rectus abdominis again right here. Dun, 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 dun. Covered with connective tissue on these 5 parts right here. Not covered right there. And what else can I see here? The external oblique is, I got ahead of myself right there. There he is. The external oblique is right there. I was already starting to cut things away. There's the external oblique. And now I can also see the internal oblique underneath it. The external is on the outside. Deep to it is the internal oblique. So the internal oblique is going to help compress your abdomen when working bilaterally. And when working unilaterally, it is an ipsilateral, a same side rotator. Underneath it is this deepest abdominal muscle called the transverse abdominis. Transverse because its fibers are running across. It is going to compress your abdominal cavity. Think about blowing out a candle. Let's pretend it was your birthday. You had a bunch of candles on the cake, and you were going to take that big breath in, and you were going to breathe out. When you breathe out really forcefully, you compress your abdomen. Your transverse abdominis does this for you. So, we've now looked at all the abdominal muscles. Rectus abdominis, transverse abdominis, external oblique, and internal oblique as well. Really good. What we can also see here are these muscles in between the ribs. These are the most delicious muscles we're going to talk about today, these muscles in between the ribs. Because they're in between the ribs, they're called intercostal muscles. There's actually going to be a pair of intercostal muscles, a group on the outside and a group on the inside. These are the outside ones we see here, so they are external. The external intercostals expand your thoracic cavity. Externals expand, which lets you breathe in. So you make your thorax big, gives you less pressure in there, and air gets sucked in. All right, good work. Let's keep going. We're close to being done here, guys, which is really good. All right, take a look at this lady here. She's pretty fit. You can see her external oblique, and you can see her rectus abdominis. See if you can point those two out. See if you can find her sternocleidomastoid as well, because I can see that also. All right, we flipped over the front of the torso to see the inside of the thoracic and abdominal walls. On the inside of the abdomen, right here, I see the transverse abdominis going across. On the inside of the thoracic wall, in between the ribs, I see the internal intercostals. Internal intercostals on the inside, right? So, internal intercostals are going to pull your rib cage in. External expands, internal pulls it in. What that is going to do, it's going to squeeze your chest cavity, which is going to push air out, helping you breathe out when you're like trying to blow out a candle or something. Okay, with that, we're going to look at one more model, similar thing. Last model for the abdomen, I think, here. We can see the transverse abdominis. All these lines going across represent the transverse abdominis. Don't worry, you'll name all these blood vessels here in A and P2. So you get that to look forward to. And we also see our internal intercostals in between the ribs here. Wonderful. Okay, now we got another abdominal muscle. Sort of a different location though. This muscle is in between the thoracic and the abdominal cavity. This muscle, it's got the number 1 on it right here. It is the diaphragm. It is a dome-shaped muscle. It's a dome-shaped muscle. In this picture here, the diaphragm is relaxed. So it's up when it's relaxed. When the diaphragm contracts, it goes down. Diaphragm contracts, it goes down. What that does is it drags your lungs down with it. So the volume above the diaphragm gets bigger. That sucks air in. when you're breathing in, during inspiration. The diaphragm is the major muscle of inspiration. Okay, got that? Got one more group of muscles to cover, and then we're done. Last group of muscles is this group of all these guys kind of going up and down adjacent to the vertebral column. These guys are known as the erector spiny. Let's translate that. They are the straightener of the spine. Don't worry about the three names here. We're just knowing the name of the group. The group is the erector spiny. Think about, are you sitting down right now? I bet you're not sitting down like perfectly straight. I wasn't either. I just sat up like perfectly straight. And it's my erector spiny that are letting me do this. Erector spiny are going to extend your trunk, so they are an antagonist to your rectus abdominis. Remember, the rectus abdominis flex the trunk, the erector spiny extend it, so they're working antagonistically here. If we look at this guy right here, he's really lean, he's muscular, so we can see his erector spiny, these bulges back down here. And with that, guys, we are done this lab. Only 2 more labs to go after this, and then you're done with A&P1 forever and ever. All right, see you later. Bye.